Hello everyone, and welcome. Welcome to this audio podcast. This audio podcast today, as part of the LabZtorm Baracade. This audio podcast, as part of the Barnacle and Storm and Bostics. This audio podcast is part of the Shipmode Squad. As part of the Shipmode Squad, this audio podcast as part of a Storm Logistics production. Through this audio podcast today, I look at the sort of the basis behind this collaboration. This collaboration. So, healthcare services have been seen or viewed in various, where there have been various changes over the decades. In around 2016, for example, the NHS, the National Health Service, and local councils came together, and that wherein there was a consensus in around 44 different areas covering of the United Kingdom to develop or co-develop to improve healthcare, co-develop ideas to improve healthcare services. Formed initially new partnerships which were referred to as sustainable transfer partnerships, or STPs. The idea is or was to envisage united services, so that, for example, our healthcare service users are precluded or prevented. Healthcare service users generally amongst populaces are precluded from poverty and impoverishment. The aims on STPs therefore have been to also interlink local NHS services, NHS National Health Services, and councils to healthcare sectors accordingly. The work behind STPs seeks to therefore be important in meeting challenges of local councils and different parts of the NHS and hospitals, family doctors or primary care teams, and in amongst broader healthcare teams and so on. However, for example, where there's tech fragmentation, networks and/or systems that where exists there are technology. There can be technology fragmentation, networks, challenges in around networks and/or systems wherein this can then make sharing information almost impossible. So retrospectively, this is because systems used or utilized between councils and the NHS are not interlinked, causing concerns at grassroots. Working together, AHPs, allied health professionals, medical and clinical teams, are in a better position to deliver for example, the NHS long-term plans, which was sort of a sort of a sub initiative, if you like, in around the NHS and National Health Services form, which was sort of works that were published in 2019 from the NHS, which aimed for what was referred to as triple integration of primary care and specialist care, in around specialist care and other aspects of healthcare services. If connectivity, for example, is unified through what was also referred to as a health and social the health and social care network, or HSCN. And so um, so that or such that sharing and transferring of confidential information is secure, reliable, and meets compliance. So every region in the United Kingdom had been invited to produce an STP, which would include plans to secure and support general practice or practices, and enable it to play its part in a more integrated pathway and in line to community services. And this would allow, in effect, healthcare professionals to document and record healthcare in a more seamless manner. in a more seamless manner, i.e., that should in effect reduce the need or requirement for duplication, etc. Um, uh, so there is also a sort of an untapped area regarding healthcare and sort of looking at in around particular illnesses and through POCT and diagnostic point of care testing and diagnostics. And the basis of this collaboration in around this was therefore the basis of this collaboration was had looked to prompt awareness surrounding polypharmacy, aspects of polypharmacy and nephrotoxicity, in around polypharmacy and nephrotoxicity through hip hop and in around permaculture. So that draws this audio podcast to a close. This audio podcast as part of the LabZtorm and Baracade. This audio podcast as part of a Barnacle and Storm and Bostics. This audio podcast as part of the Shipmo Squad. This audio podcast as part of a Storm Robotics production.